So we have been working last year with the HERVCOV project with around John in the Aragon, Zaragoza. So we recollected 2 cohorts. One of the cohorts is from long COVID patients, and the other cohort was formed by people who has passed COVID and is asymptomatic. So we made with them a lot of questionnaires and biomarkers, analysis, mental, cognitive exams, physical examinations, and so what. Now, at this moment, we are analyzing the biomarkers, and we found it a little kit of biomarkers. We have made big difference or significant difference with between the 2 groups. At this moment, we are beginning again to make the same analysis to the same cohort and to the other cohort without COVID, the control cohort. So this is our work, our task in last year, in the 2 or 3 last year at least. So the main aim of the HERVCOV project is to analyze how what happened, why some people develop long COVID and some people is getting without illness. In this context, we have thought about the option of the hypothesis that there are patients, they are illness, and now at this moment fibromyalgia, but fibromyalgia and chronic fatigue syndrome has a very similitudes with long COVID. I explain more. They are almost then are women, almost then are in the middle age, almost then are professionals, and they almost then began in COVID. Long COVID is clear, they began with infection for COVID, but in fibromyalgia most of them began their illness with infectious, uncommon infection, various infections. So our hypothesis is there are a next common union, a link between fibromyalgia and chronic fatigue illness and long COVID, because the way to get in illness is very similar. So we are going to begin in the context of HERVCOV project a new cohort including fibromyalgia and chronic fatigue illness in order to compare the biomarkers, the social, epidemiological and demographic markers in characteristics in the 2 groups, and to try to understand how is the way, what happened with patients with fibromyalgia and chronic fatigue.